Have a great day. Now, in this presentation, I want to talk about breast implant surgery. Now, there is a lot of discussion going on in the internet, if you just go out and ask about it. But basically, implant surgery is very simple, and to talk about it is also very simple. There are basic three questions in order to understand implant surgery. The first question is from where we need to enter. So, where is going to be the incision line? Inframammary, periareolar, or axillary? The second question is about where to put the implant. So, shall we put the implant behind the gland or behind the muscle? And the third basic question is what sort of an implant we need to put, like a cohesive gel implant or a saline fill implant, etc. So, I want to discuss with you all these three basic questions in this surgery. The first question is from where we need to enter, where shall we put the incision? There are three options. The first option is periareolar, so just around the areola. Basically, lately in the last few years, we are slowly getting away from this approach, just due to one reason, because if you just enter periareolarly, due to the corruption from the glands, from the milk glands, there's a much higher risk of implant rejection. So it's not a very good idea to use the perioral as long as it's very much necessary. The second option is from the axilla. This is also not a very good option because this is the area where all the lymph drainage are going through. So basically, the general surgeons don't like this approach very much in case if you have any problem in the future. The healthiest and the nicest approach is going to be through the inframammary approach. There are a few reasons why we like that at most, because first of all, it is concealed. When you put the implant inside, there will be a line anyway, naturally, and the incision will stay in that line, so it will not be visible. And the second very good advantage of that approach is when you enter from the inframammary fold, you're just going to go inside, put the implant and get out. Basically, you don't touch the breast tissue at all, which means that you are not going to have any problem with breastfeeding or with post-operative or late breast follow-ups, etc. So this is going to be the healthiest way. Now the second question is about where we need to put the implants. It's also very simple. You know, the anatomy, there is a breast muscle like the man have, and then the females have a breast tissue above it. Basically, we can put the implant either behind the gland, so in front of the muscle, or behind the muscle also. If you put the implant behind the gland, which is called to be the subglandular approach, the advantage is it's not going to be painful at all because there is not going to be any stretch of the muscle. On the other hand, if the patient is having a very thin skin, then you might have some problems like the visibility of the implant around, particularly around the upper pole. If you put the implant totally below the muscle, it will be too strict, too tight, and it's going to be very painful. The best possible option, of course, is the combination of both of them, which is called to be a dual plane, which means halfly below the gland, halfly below the muscle. So what we put in this technique is we put the implant below the muscle on the upper pole, and in the lower pole it's going to stay below the gland, which means on the upper pole it's going to be totally concealed, so it is not going to be visible at all. Whereas in the lower pole, the implant is going to stay behind the gland, which is going to give a very natural outcome, but also because the muscle is not going to be stretched at its entrance, it's not going to be painful at all. So it's a good compromise for both options. Now the third question is what sort of an implant we need to put inside. There are round implants, there are cohesive gel implants, but under any circumstance, the must to do is to use some sort of a cohesive gel implant, which means even if you cut the implant with a knife, it is not going to be leaking out. That means it's going to be a lifelong implant. You don't need to change it when you get pregnant, you don't need to change it when you get 50, you don't need to change it. But of course, then you can have a round implant or an anatomical implant. What are the options? What are the advantages? If you put a round implant, you are going to have a more décolleté look, which is a preference. But if you want to have a more natural outcome, like a more teardrop-shaped breast, then it's better to use an anatomical shape implant, which is going to enforce its shape to the breast, so nobody will be able to tell, even by touching, that you have implants inside. What about the surgery practically? Well, basically it's a very simple surgery for the patient, and the operation takes around 25 minutes for one side, 25 minutes to the other side, so altogether it's a 50 minutes surgery. It's a day surgery, so you come in the morning and you can leave it at the same day and you can go home. After 2 days you are going to be able to take your shower, and after 3 to 4 days you can go back to work. Even after a week you can go to sea, sun, or even swimming pool. There's no problem with that.